Hello friends! In my last video, we have known the symptoms of thyroid disorder. In this video, let us see who should be tested. If you think you have the symptoms of a thyroid problem, ask your doctor if you should be tested. People with symptoms or risk factors may need more tests often. Hypothyroidism more frequently affects women over age 60. Hyperthyroidism is also more common in women. A family history raises your risk of either disorder. Thyroid neck check. A careful look in the mirror may help you spot an enlarged thyroid that needs a doctor's attention. Tip your head back, take a drink of water, and as you swallow, examine your neck below the Adam's apple and above the collarbone. Look for bulges or protrusions, then repeat the process a few times. See a doctor promptly if you see a bulge or lump. Diagnosing thyroid disorders. If your doctor suspects a thyroid disorder, a blood test can help provide an answer. This test measures the level of thyroid stimulating hormone TSH, a kind of master hormone that regulates the work of the thyroid gland. Along with TSH measurements, thyroid hormone levels are also analyzed. If TSH is high, it typically means that your thyroid function is too low, hypothyroid. If TSH is low, then it generally means the thyroid is overactive, hyperthyroid. Your doctor may also check levels of other thyroid hormones in your blood. In some cases, imaging studies are used and biopsies are taken to evaluate a thyroid abnormality. Hashimoto's disease. The most common cause of hypothyroidism is Hashimoto's disease. This is an autoimmune disorder in which the body attacks the thyroid gland. The result is damage to the thyroid, preventing it from producing enough hormones. Hashimoto's disease tends to run in families. Other causes of hypothyroidism. In some cases, hypothyroidism results from a problem with the pituitary gland, which is at the base of the brain. This gland produces thyroid stimulating hormone TSH, which tells the thyroid to do its job. If your pituitary gland does not produce enough TSH, levels of thyroid hormones will fall. Other causes of hypothyroidism include temporary inflammation of the thyroid or medications that affect thyroid function. Graves' disease. The most common cause of hyperthyroidism is Graves' disease. This is an autoimmune disorder that attacks the thyroid gland and triggers the release of high levels of thyroid hormones. One of the hallmarks of Graves' disease is a visible and uncomfortable swelling behind the eyes, which can trigger thyroid eye disease. Other causes of hyperthyroidism. Hyperthyroidism can also result from thyroid nodules. These are lumps that develop inside the thyroid and sometimes begin producing thyroid hormones. Large lumps may create a noticeable goiter. Smaller lumps can be detected with ultrasound. A thyroid uptake and scan can tell if the lump is producing too much thyroid hormone. Thyroid disorder complications. When left untreated, hypothyroidism can raise cholesterol levels and make you more likely to have a stroke or heart attack. In several cases, very low levels of thyroid hormones can trigger a loss of consciousness and life-threatening drop in body temperature. Untreated hyperthyroidism can cause serious heart problems and brittle bones. Treating hyperthyroidism. The most common option in treating adults is radioactive iodine, which destroys the thyroid gland over the course of 6 to 18 weeks. Once the gland is destroyed or removed by surgery, most patients must begin taking thyroid hormones in a pill form. Another common treatment for hyperthyroidism is anti-thyroid medication, which aims to lower the amount of hormones produced by the thyroid. The condition may eventually go away, but many people need to remain on medication for the long term. Other drugs may be given to reduce symptoms such as rapid pulse and tremors. Surgery for thyroid disorders. Removing the thyroid gland can cure hyperthyroidism, but the procedure is only recommended if anti-thyroid drugs don't work or if there is a large goiter. Surgery may also be recommended for patients with thyroid nodules. Once the thyroid is removed, most patients require daily supplements of thyroid hormones to avoid developing hypothyroidism. What about thyroid cancer? Thyroid cancer is uncommon and is among the least deadly. The main symptom is a lump or swelling in the neck, and only about 5% of thyroid nodules turn out to be cancerous. When thyroid cancer is diagnosed, it is most often treated with surgery followed by radioactive iodine therapy or, in some cases, external radiation therapy. This is all about thyroid. Hope it helps you in some or the other way. Thank you and see you again.